It just sounded like um, either the website was underdeveloped, not tested properly with quality QA, quality assurance people, and you had just almost like a mismanagement from like a project launch.
Yeah, and it's they don't even have the excuse of being like some little rinky-dink startup. Like this was the government.
Hey everybody, this is Eve Eden.
Hey, and I'm Brian Crowley. Welcome to UX Murder Mystery. Eve, so today we're talking about Healthcare.gov.
Oh my God. There's definitely a story around that.
Yeah, so Eve, in October 1st, 2013, the government spent $1.7 billion. They had millions of Americans that were waiting for their health insurance. What was supposed to happen that day?
Yeah, right. So there was a launch on October 1st, 2013, and it was to the enrollment portal for the Affordable Care Act. And what was supposed to happen is you go on this website and basically attempt to enroll yourself in healthcare that is being serviced by the government. What ended up happening, I think people were really excited because 8 million of them attempted to use the site in the first few days it launched, and only 1% of them were able to successfully create accounts. Can you believe that?
Yeah, I saw that it looks like the site went live and only 6 people were able to enroll on day one, and it was like 6 out of 250,000 who showed up.
Yeah. Yeah, I got a stat here too that says in the first week, only about 26,000 people completed enrollment despite the millions that were trying to access that system.
So, as a UX professional, what do you think? What's your reaction when you hear those kind of numbers?
I mean, the one of the first things I think, especially like you're talking about, early 2010s, the UX industry at that point, I think was, making a name for itself. I think we're transitioning, especially from like web design to really focusing on products and how these digital products, they may have been physical in some sort of nature, like paper documentation, and now they were moving into this digital format. So you had a digital product on your hands, and
Yeah.
so they needed people who were skilled in user experience to test sites, make sure that people, that were filling out the application weren't being hindered by required fields or just information that may not pertain to them, but there it was giving them hangups. So it just sounded like um, either the website was underdeveloped, not tested properly with quality QA, quality assurance people, and you had just almost like a mismanagement from like a project launch.
Yeah, and it's they don't even have the excuse of being like some little rinky-dink startup. Like this was the government, right? Launching like one of the most scrutinized bills and in government history, and they had billions of dollars at stake. How does something this visible fail so completely?
Yeah, I mean, that's where I do feel like there was fragmentation. And similar to maybe your experience, Brian, and
Yeah.
myself, probably people that are listening, when you are in a corporate environment, departments kind of run almost silo to each other. At times, you're talking about sales department and marketing department. If they're not communicating properly, they're kind of just doing their own thing. And so there has to be this kind of what people call cross-functional teams where there is this constant communication of what we're doing, what we're building, how we're doing it, why, and how it's going to impact another department. And it feels like when Healthcare.gov launched, it was almost like a classic example of governance failures, where you had fragmented contractors, a weak UX architecture, that just, I think, collapsed the digital product.
Is it true that there were 55 contractors?
Yeah, I looked at that too, and what I gathered, and this is something, if anybody knows facts, correct us here,
Yeah.
comment. I believe what I see was about 50, like a system architecture involvement, more than 50 contractors, and 60 separate federal and state data integrations created this massive coordination failure. So, I don't know how many contractors per se, but that was just some of the other stats around just the architecture and how it was built with the integrations.
Now, at the same time as all of this was happening, one thing that I saw that happened was the registration wall, where they were blocking people. So you had to create an account, a username, password, and security questions before you could even browse or take a look at the plans that were available. And I see that Nielsen Norman called this a textbook textbook violation of the law of reciprocity, which is that the same reason Amazon or any shopping experiences don't stop you from logging in before you can browse. The idea is that you want to look at the website, you want to look at what's available if you're going to purchase something before you register. Could you break that down for listeners?
Yeah, so I think what it seems like that happened is like once you got past registration, if you did, um, there wasn't necessarily what you would coin as information architecture, from a wayfinding
Yeah.
perspective. So how to find your way through things. Like think about um, an atlas. I know that's like hard hard to imagine nowadays. I used to have an atlas in my car,
I did
right?
too.
Right? Do you
Yeah.
remember this? And
Oh, yeah.
this was how we found out how to get to a town or, like your, friend's house, if you were going there for the first time. And then after that, you pretty much memorized it, if you were going to go there often. And that map was something you studied before you got on the road and kind of knew in your head where you were going. And so that wayfinding of an atlas, or even think about maybe a common one would be going to the mall, right? Like
Mhm.
how do you know once you walk into the mall where you are going?
Mhm.
Usually there's the obvious signage of where to go if you want information. Think about the airport, right? There's like these kind of intuitive places where you would go to the center of a location or to a map and find out, like, is this on the second floor? Where do I go and pick up my luggage or something like that? So yeah, from that point of view, from a website, a digital perspective, the wayfinding of like navigation, breadcrumbs, where you were within, like, let's say a progression of screens. So no progress bar, no step count, no no back button. The application, what they said is the application for one test user took almost 55 minutes. So, yeah, that was the absence of any of those signals.
Wow.
So you knew how to find your way.
Wow. So what does the absence of navigation signals do to someone who's already stressed out about their health insurance?
I mean, that's the thing, Brian, right? You're talking about like you're piling on top of a stressful situation. Maybe you're sick, maybe a loved one is, I don't know. Like you're, this isn't something like pleasant. You're not planning a trip,
Right.
right? So on top of that, you're adding all of this friction with a website that you do not know how to use. Maybe it was your first time on this site. And so there's just so much of that that is critical to, making sure, am I selecting the right thing? Because it's insurance companies unfortunately don't make this any easier, where the language could be sound very legalese language, and so you're not necessarily sure, do I understand the terminology that's being stated to me? Is this the coverage that I need for my loved one or for myself? Am I going to get the help I need when I walk into a doctor's office? um, and so with that, the homepage had carousels with like 5 tabs. There were redundant CTAs, call to actions,
Mhm.
on the page. And what you were doing also is the apply button was hidden below the fold. Now, um, being from a different era, below the fold at this point, I'm sure you guys know, but if not, is when the web page goes below the viewport. So imagine your laptop or even your mobile screen. At the It wasn't assumed that you were going to scroll. Now we kind of have the infinite scroll behavior, and so scrolling is just a intuitive part of laptops and mobile apps. Before that, it wasn't. So below the fold, it was very crucial you had a main call to action above the viewport, so you didn't scroll, but you knew what to do immediately.
So I'm in my dad's office, who worked at a newspaper, and fun fact is below the fold originates with newspapers because newspapers used to actually fold, and then in the internet where we don't have where the internet doesn't fold, um, we've adopted that term for some reason to be below the top of the screen, which makes no sense, but whatever.
Yeah, I mean, another thing that was happening too is critical components were delivered weeks before the launch, leaving engineers almost no time for integration testing.
Yeah.
And so these are like things that are, I mean, Brian and I know, and I'm sure most of you that are listening to us have worked in these teams where, I mean, there's just like crucial steps that were missed and could not be done. I think because was there something about that date that needed to be met? I don't know why they were like really like gun ho about launching on in October like that. Oh, I was just thinking because it was October 1st, one thing insurance companies do, which I never understood,
Yeah.
is why everyone has to enroll in the month of November. If you pass the November date or this kind of like enrollment period, you have to wait a full year.
The only thing I could think as to like why they may have been pushing that date, I wonder if it had to do with the election cycles. And I don't know. I don't know the answer to that, but I'm wondering if it was going to be a because it was the in 2013. So I would think that the next year would have been 2014, and there would have been like a midterm of an election cycle. And I wonder if it was like one of those things where they wanted to get out ACA, or so they had an ACA leased and they wanted to get ACA enrollment before a midterm could come, and they could possibly vote to undo that if they lost the majority in the House.
Yeah, that makes sense too. That could be it.
I,
Yeah, I think my logic was more around, what I don't know why that cycle, it might have to do with taxes, the tax year ending.
yeah,
Yeah.
And it could also be have done with all those contractors and all their terms and all their links of how they could have been on. When we're thinking about this, there's also the idea we were talking about the um, information being hidden and the idea of some redundant CTAs. Could we talk about how information architecture and products can kill a product?
Oh, I mean, yes. So those classic examples of wayfinding, like the atlas in your car before GPS was a thing. Um, remember TomTom? Anyway,
Yes.
yeah, I remember like wow, like just being in like I was like in awe of people that had a system like that in their car already. But you were lugging around physical products or, like tools in order to, like get to your destination, um, find a location within, let's say, a larger complex like a mall. um Without those structures, one thing I'm no- you know when one thing I noticed too is, I mean, these types of things actually come into play often in our lives. They're almost, Brian, I would say, almost invisible at this point. You're not necessarily thinking of information architecture on a daily basis.
Mhm.
And for example, what I mean when I say that is, not only is IA architecture everywhere, it is in the navigation of a website, right? It is in the categories when you walk into a grocery store. It is in the how a layout is in a hospital. It's in the way like your phone organizes your applications. Like, do you put them, in folders, structure, or on, individual pages on your phone? Even
Encyclopedia.
the way AI is, and how it retrieves knowledge. The
Yeah.
library system is another one as well.
Yeah, I was
Sorry.
going to say encyclopedias and dictionaries are also
Totally.
right.
Yeah.
Um,
Yeah. So just think about it as every time you search, you browse, you filter, or you make a decision, you are interacting with information architecture.
one thing that we also have to discuss with this whole situation is that doesn't get discussed really enough is the users. And a lot of the people that were signing up, the tens of millions, a lot of them, it was people that perhaps had low literacy or low technical literacy,
Sure.
who might have been elderly, people with disabilities, low healthcare literacy. I've noticed. I can say just from my own personal experience, um, we actually had kind of an interesting story with that.
Yeah.
And recently had to go in for a colonoscopy. And when you do a colonoscopy, you get a lot of literature about what you need to do. And even me, as like somebody who I feel like was college educated, I had to like print this stuff out and then ask my wife and like talk about it because my wife has a background in healthcare and she can kind of like walk me through some of that. But and one of the things that you have to do with a colonoscopy is you have to not eat for a bit of time before
So
heading.
wait, are you fasting like for a period of time?
Like it's usually like you have to do a liquid diet the day before, and then you have to
Yeah.
drink a thing that to clear yourself out, basically.
Yeah.
So we go into the waiting room, and we're sitting down in the waiting room, and we go in and we sit, and then suddenly we hear crinkle, 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 and there's a couple where they have a bag of snacks and they're just going to town on it. And they're going to town on it. And the receptionist is like, "What are you doing? You're not supposed to be eating for this." Had to go talk to the doctor and they had to like send them out of the room. And so while that's happening, my wife and I are texting each other, like, what in the hell is going on here? Who does this? Like, what is happening? And initially, our reaction was like, who are these people? Why are they doing this? What lunatics? But then the couple came back in and they started asking, and they were like, we didn't get the information about
Wow.
the prep. We didn't get any of the information about the instructions. So they're a prime example of these users, the people that just fall through the cracks in our medical system. So it just is an example. And when we think about how design can fail these people spectacularly.
Right. So really, it's like they launched a national healthcare marketplace with the capacity of a small e-commerce website. I mean, that's kind of where it
Huge
just
mismatch.
feels right. It
Yeah.
just feels like kind of failed. It failed the broad number of people that would have been, what we account as the 80/20 rule. 80/20, when, talking about that rule, is you're designing for the majority.
Yeah.
The 20 still count. We're not leaving them off, but they are fringe cases that we address in a priority order with a weighted system of what is the business outcomes. And so as you can see, like the UX industry isn't just I'm designing a layout and there's like a color we want and some white space. This is a methodical, heavily backed research way of creation of a digital product, that almost every design decision you're making is generally based on data that you received from your discovery phase.
Yeah, and I'm even wondering what discovery might have even been done, or if there was discovery even done, because I was reading that apparently the front end of the website and the back end enrollment engine were built by completely different contractors who had apparently never coordinated.
Right. Well, one thing I also read is because of the site required users to create an account before they could even view insurance plans. So, which meant that like millions of people were being pushed into the most complex part of the system immediately, right? And so there was no browsing and understanding what you're getting yourself into. You're just needing account creation. And because the identity verification required calls to the IRS and Social Security login, can you imagine what those websites were like? Or
Mhm.
those like integration apps? The registration system became the primary bottleneck, which collapsed under the demand of the 8 million people that were trying to get there within, let's say, the first week. Yeah. So I think another thing to mention too is, these are kind of like nails in the coffin. And so we're talking about the forced account creation before browsing. Another one that we could talk about, and we touched on it very briefly, is like the load testing. So there was the system was barely even tested at real scale before it launched. Even through like the expectations of millions of Americans enrolling within the first few weeks, there were reports that revealed that the system was only designed for about 1,100 users, while there were tens of thousands trying to log in, create login and attempt to, get plans. Um, so I think it was just kind of a massive back end integration nightmare as well.
So what do we think? Well, if we were to ask the big question of like who killed Healthcare.gov, who would you point to as as a suspect or suspects?
Well, healthcare.gov failure wasn't a UX problem alone. It was a systems problem where product ownership, the architecture, the engineering architecture, and the user experience were never aligned. And that's what we were talking about kind of at the top of the hour, where these departments need to communicate with each other. If sales doesn't understand what marketing is advertising, and they're getting an influx of leads, how is that salesperson supposed to drive account creation or sales, like getting the client, if they don't understand what marketing is promoting? And so that's what I'm talking about. If user experience, product management, and the engineers weren't necessarily, they were siloed and not communicating with each other, this is that classic example of, who done it.
It sounds like it was it's really it's a process problem. It was almost like they needed service design. Like they needed the UX to like take a step up and get to the meta level of the service design of how the team is working together first before they break even broke into the doing of the work. It's like sometimes, you have to set up the workshops and determine how we're going to do the work, how we're going to work together, like when we're going
Right.
to meet, how things are going to execute before you even start with part one.
Right. And we should consider that this is about 12 years ago or so, right?
Yeah.
So, what was service design like 12 years ago?
Yeah.
Like that,
It
we
was-
have to really kind of step back into time because, again, user experience, this is where I do feel like it's still in its infancy as almost like a qualifier of what it can do to transform a business. This is not a service. User experience is not a service that you have a dollar amount and you budget in. This is literally the building of your product and how successful your business outcomes are going to be because of how easy or efficient this platform is.
So I'm reading that uh, CMS officials, and I'm assuming CMS stands for Content Management System officials.
Yeah.
They apparently were um, desensitized to bad news. They became so used to warnings that they couldn't distinguish catastrophic risk from routine project noise. So that's a really interesting question, which is as UX leaders, how do we start recognizing when the organizations have normalized dysfunction? And when we say normalized dysfunction, when they've just decided that every alarm that goes off is just who cares, which is a big problem.
Yeah, no kidding. How about one of the biggest problems was what we saw like a few years ago. I think this happened during COVID
Yeah.
with the Notre Dame church burning down, right? That there was a localized fire, and in the system, it was being shown like it was like the system had an alert that was not showing the kind of catastrophe or what was actually happening within the building. And so nobody knew that this error was actually like, hey, there's a localized fire in a certain section of the church.
Well, it was bound to happen. Griffin has decided to join us on the
Oh,
podcast.
good. We need a new guest.
Yeah. So Um, so yeah, so the Notre Dame, it was a localized fire, and they weren't paying attention to that. And that's what lit up the rest of the church.
Well, it was that was a UX failure, and that's actually a really good maybe podcast episode of
Yeah.
how alerts and warnings and errors on your system, if they're being used too often, become things that are ignored. So if you're wanting it to be a critical thing that only appears when it demands action, and you're using it too often, people will like be blind to those types of interface interactions.
Do you remember a couple of years ago, on the flip side of that, do you remember a couple of years ago when Hawaii, the entire island of Hawaii, got alerted that a nuclear strike was incoming?
I totally remember that.
Yeah,
Yes.
'cause that's, boy, talk about that.
Yeah, people thought they were gonna die. There was like 10 minutes of chaos.
Right. Yeah. I mean, talk about like that's also like it's so interesting to think because like imagine now I think of like what if a Hawaiian now got the same alert? Would they just think it's another error? Would they assume it was an error, you know?
This is where again the user experience is so crucial. And what we're seeing with like mass layoffs and kind of like the dismantling of the product department within these major corporations is honestly for me a heavy pushback on, what a digital product needs in the first place.
It also says here that um, we had 55 plus contractors, no systems integration, cost reimbursable contracts that paid regardless of outcomes. So I guess the question is the federal procurement system fundamentally incompatible with good user experience? That's an interesting question.
So what's the question?
Is the procurement system within the federal government, is it fundamentally incompatible with good user experience? Because there is like a thing with, I mean, we know because we've worked at big corporate companies where procuring or like getting approved vendors is like a whole rigmarole and can take months to years sometimes to get like approved vendors.
Yeah. Wouldn't you say it's almost like instead of them launching this, a product, healthcare.gov, they launched, do you remember what construction sites are?
Oh yeah,
Right? It was just this like site like, hey, coming soon.
right,
And there's like,
right.
that's what it feels like when you're talking about that. It feels like that's it. They launch a construction site.
Totally, totally. Or with like the little tractor on it and like the little gif of a tractor or whatever, or the little like,
Right. And the orange
yeah,
street cones.
orange cone. Yeah. Which is like now that is known, like that used to be like a fairly common thing that you would see. And now it's like a known like bad pattern.
Right.
So 6 weeks after the launch, the White House apparently brought in a tiger team. Uh, they brought in Google's Mikey Dickerson, a former O&B director, Jeff Zentz, and CTO Todd Park. They put together a war room. I guess they had three rules. They had no finger, no finger pointing, knowledge
Yeah.
over rank, and only the most important issues get discussed.
Yes. Yeah. They
Oh,
called the team Tech Surge team.
really?
It was led by engineers from Google and other private tech firms to rebuild the system.
Those are pretty.
And
What do we think UXers could learn from that?
well, that's like, that is an interesting point. What do you learn from like launching something it failed and then bringing on a team? I bet this team hardly went to bed, right? I'm sure they worked around the clock because what happened within 2 months, the team dramatically improved the performance and increased the capacity of the hundreds of thousands of concurrent users that were on the system. And so I think what I read was by the time April 2014 rolled around, there was more than 8 million Americans that had successfully enrolled in health insurance through the website.
It also looks like, along with people being able to finally get into the website, it looks like the Healthcare.gov failure led directly to the U.S. digital services in 2014. And the design agency, the internal design agency, which was 18F, which had a bunch of great designers working for them. And then it looks like, and Nava PBC built a modern design system based on the US web design standards.
Yeah, when you asked the question of what should you learn, like what would we have learned from this?
Yeah.
Did you have like anything that kind of like stuck out to you?
I think the biggest benefit from the failure of healthcare.gov was them realizing, oh shit, we need to have this is kind of like the beginnings of the internal teams, right? You suddenly saw, I mean, before that, you were seeing a lot of people bringing in internal teams, but it was nice that the federal governments decided, oh, you know what? Having design services, having software, digital services in house is something that we need, and will save them money and time versus contractors. And 18F was a fantastic organization and had like a real gold standard of digital design, and accessibility standards and all of that. And then I believe they've shut down 18F recently. I think they all got doged. Um,
Wow.
but that's kind of that to me. I think that's kind of started that trend of the in-house design agencies and the bring it in-house instead of contracting it out.
I don't know how I feel about the internal parts of design. We've discussed that in previous podcasts,
Yeah,
but I definitely have a strong opinion of that in her internal design teams, I feel like may not be pushing the envelope for businesses as they should,
yeah,
but instead kind of deliver mediocre standards. At least in my experience, that's what I noticed. And what they generally do is they try to hire in people that can, motivate teams and inspire them to do more. When the product is lacking. And generally, when how people identify when the product is lacking is their clients leave,
yeah,
they lose contracts,
yeah.
the success rate falls, right? People complain about the product. They usually put them on blast on like a LinkedIn posts. You might see like negative reviews on Glassdoor or wherever it is that people that use that product can out them. Usually, you'll see them in like app reviews. That's when people really like let people have it too.
I feel that I have mixed feelings as well about internal versus external. And I feel like it always depends on context. In some cases, I think internal can be great. Like the government kind of makes sense to have some internal people working there versus having to rely on contractors. But I feel like for other businesses, it almost doesn't make sense. You're almost doing yourself a disservice in some ways. Um, especially some small businesses, because I think you can get more out of having contractors or having external consultant help.
I mean, but the search team that they led or led by the engineers from companies like Google
Yeah,
was a classic example of bringing someone out, like to, like that was kind of outside of the system in.
yeah,
I think what ended up happening was it was like it was the governance and just like the launching of, how this product should have been built out. I actually think it was more about them, like when you're building a product, your timeline needs to flux.
yeah,
And for them to push on the October 1st timing, I think was the final nail in the coffin. They they desired so much to launch something that day that they lost credibility. And to the point, didn't you have a story about like what like Obama kind of just losing losing his marbles because of like the launch itself or something? I thought maybe you had
Oh
mentioned
yeah,
something.
there's a so there's a podcast called Pod Save America, which is run
Yeah.
by the former Obama officials and former Obama speechwriters and other officials, and they were basically saying that the failure of Healthcare.gov, they said that it was the angriest they'd ever seen him in the White House
I bet.
about that. Yeah. And if
Sure.
I can find that episode, I will link to it in our show notes for
Yeah, I
people to
think
go
that would be
watch.
great.
Yeah. So Eve, if let's say uh, healthcare.gov, and the new version, whatever the ACA is going to do a revamp of their website, and they walked to you today, and they had the same constraints, same stakeholders, same political pressures. What is one thing that you would demand before you were to take on this project?
Yeah, I think especially with what we know today,
Yeah.
is that the timeline needs to be something that is flexible. And that, if you're wanting to meet a date, especially when you're preparing, like, creating a digital product like this, which was, in my mind, net new. There was nothing like this before. You can't have this hard and fast rule of like a launch date. And in my experience, the launch date at several places had to be moved because you just can't anticipate like how long integrations take, how long research on like engineering architecture takes, how long that, I mean, as a designer, we have an easier time to build and think up innovation. It's the engineers that have to actually practically put this in place. And if there are things like integrations and APIs that need to be tested, those things need take time to do.
Mhm.
And so I think like things like the IRS and the Social Security Administration, to have those things be sussed out, um, just need time. And so I think for me, it would be the flexibility on launch date.
Yeah. Um, you know, one thing that I would push for would if I was doing the same thing is I would push for testing as soon as possible. I feel like, when we were talking about information architecture, I remember years
Yeah.
ago being at a web agency where somebody tasked me with doing some information architecture. That was for an internal thing. And I remember then getting in the room and getting and wanting people in the room to test out what we were doing and getting berated for doing that. And it's like, no, you have to fucking test stuff early. It has to happen. Like you're never going to get right off the bat. And if you are not like testing it early to make sure that you can test, learn, iterate, like, you're always gonna bomb it, in my opinion.
Yeah, you know what? That's another thing to kind of point out is, the C-suite, the executives, they need to take a step back. I mean, we are like when we are testing with end users or validating assumptions and need, especially from a B2B standpoint, B2B is so obtuse when it comes to talking to like the end user.
Oh yeah.
Um,
Oh yeah.
y- we need to like fit, these are all assumptions. You or I, anyone sitting on the executive level, we are not the user, so we must talk and test to an end client, several of them, so we can make sure, is this platform like something that we're going to hand over to the dev team and spend almost $36,000 a sprint. That is an actual number that I know how much 2-week sprints costs, of course, depending on how many developers you have, a designer, a product manager. But spending $36,000 every 2 weeks until the product's launched, I mean, this isn't like chump change.
Right.
This is like lots of money. You're handing over prototypes and assumptions that we made without testing them. That doesn't make any sense.
Not at all. The bigger question is, what would Griffin do? How would Griffin solve this problem?
You know what? Griffin is, I think he's having the time of his life right now. And I think we all need to be kind of cuddled and hung, just like hang out
What do you think? Yeah.
comfy.
All right.
Yeah, he's like completely just like a happy clam. Well,
All right.
I think that's it, you guys. Any questions or comments, you can always leave them down in this YouTube video, or you can email us at questions@uxmurdermystery.com. Like, subscribe, and follow, or become our next victim of bad UX.
UX Murder Mystery is a joint production of Eve, User Experience Design Agency, and Crowley UX, where systems meet stories. It's hosted by Brian J. Crowley and Eve Eden. Edited by Kelsey Smith. Intro animation and logo design by Brian J. Crowley. Music is by Nicholas Lee. You can follow us at UX Murder Mystery. You can email us at questions@uxmurdermystery.com. UX Murder Mystery is a copyright 2025, Brian J. Crowley and Eve Eden. Thanks for listening.